Welcome participants to an interesting class on disease management. Today we'll be discussing on common diseases of fish in freshwater aquaculture, their management and control. मछलियों के सामान्य रोग, उनके पहचान और उपचार. Myself Dr. S.S. Mishra, Principal Scientist and Head of the Division, Fish Health Management Division at ICR, Central Institute of Freshwater Aquaculture, Bhubaneswar, Odisha. This institute is under ICR, Indian Council of Agricultural Research, New Delhi, and this institute became independent as a national institute during 1987, and it is under NACA program and FO program. Different programs been taken off in this institute on different aspects of aquaculture. Now, today's topic for discussion is common diseases of fish in freshwater aquaculture, how to diagnose them, how to control and manage. Now, fish disease. Fish disease is a major constraint to aquaculture development. As you know, nearly 10 to 15% production loss occurs due to disease. Disease may be in the form of morbidity, mortality, and fish kills that causes economic loss to the farmers. Now, very important, मछलियों में रोग होता है कैसे? How disease occurs in fish in aquaculture system. This important point, we should know how disease occurs so that we can take suitable preventive and control measures to control the mortality. Now, in aquatic system, it is a very typical system in which host pathogen interaction is very important to decide the fate of disease. As you know, it is the environment, the culture system, the pathogens are the bacteria, parasites, or virus present in the aquatic system, and the fish. So three interaction of environment, pathogen, and fish, they decide whether there will be disease or the health condition. So if you see this particular slide, you will know that when the host is susceptible, having stressed, and the environment is conducive for pathogen to multiply, the pathogen then increase in number and the time they produce disease. So stress is very, very important predisposing factor for inducing disease in aquaculture system. Stress, what is stress and how it occurs? What the number of factors are responsible for inducing stress in culture system? What are the number of factors? The number one is overcrowding, adhiktam sanchay. So that number of fish we are stocking in the culture system is very important. You should go as per the carrying capacity of the system. Second is water quality. Poor water quality, having high organic load and low alkalinity, is responsible for causing disease in aquaculture system. Then lack of proper feeding. You need nutritious feed and quality feed. Otherwise, the fish will not have proper nutrition. There will be emaciation. And another important factor is sudden change in environmental temperature. When there is temperature change, then animal becomes stressed. Then use of different drugs and chemicals in aquaculture system. We apply different drugs and chemicals in aquaculture system to control the disease. Those chemicals, they induce stress on the fish. So now we'll see when disease occurs in aquatic system. Now there is seasonal variation is there. So mainly the three factors. One is post-rainy season, when after rain, lot of organic loads in the culture system that increase stress to animals. The onset of winter when temperature drops, and the change of temperature there, temperature drops. So when post-winter when temperature also increase from low temperature becomes high. So in that, the sudden change of temperature is there, that time the animals become more stressed, and the stress is leading to disease. Now, three factors are there which are responsible for disease occurrence in animals. What are the three factors? One is physical factor, chemical factor, and biological factor. The physical factors are temperature, extreme temperature changes, and radiation due to sunlight. And chemical factors are environmental contaminants, the toxins, They are coming into the water, contaminating the water system, especially after acid rain, or discharge from factories, or after rain, some discharge from other sources, domestic sewage is coming, and nutritional imbalances because of improper nutrition there. That also is coming. That is also coming under chemical agents, and another is drug and chemicals that we use in aquatic system. These also chemicals. These are all non-infectious agents. The physical agents and chemical agents, the factors that I described, that they are coming under the category of non-infectious agents. And then another category, very important one, is biological agents. These are, under this come viruses, bacteria, fungi, and parasites. These are called the infectious agents. So we have two types of agents: infectious agents and non-infectious agents. Now we'll go for non-infectious physical agents. What are the physical agents? Three physical agents normally we'll discuss. Their water quality, food quality, and seed quality, the stockings density or seed quality. These physical factors are very, very important. The water quality is very important, but often it is neglected. People don't know much about the water quality, but water quality is inducing disease in the culture system. So what are different parameters? The DO, diesel gases like oxygen or carbon dioxide, the waste products like ammonia, nitrite, the alkalinity, and the pH of the water culture system, and the hardness, the calcium, magnesium, they are the iron level also. They are the important factors responsible for maintaining the water quality. And what's the optimum water quality? Water quality pH should be between 7.5 and 8.5. And the alkalinity, the total alkalinity should be always more than 100 in case of grow-out system. And hardness is similarly total alkalinity, it should be always more than 100. And ammonia should always be less than 1 ppm, and DO should always be above 3 ppm. Less than 3 ppm, they induce disease, stress, and the animal may die due to lack of oxygen. Then important is another factor is food quality. Food quality, the nutritionally balanced feed is essential. Like other animals need, the fish also need nutritionally balanced feed because it contains various minerals, vitamins, and nutrients. So the appropriate protein and fat level. So these parameters, they induce the growth of the fish and also immunity status. The vitamin, minerals, the micronutrients. If you don't have such micronutrients in the feed, there will be deformity, scale loss, slow growth. Fish become prone to disease. So the maintaining a quality, giving proper quality food, quality feed to animals is very, very important. Then comes the quality seed. You should have properly quality, healthy seed, disease-free seed from a proper source, the right species, then right stocking density, and from certified hatchery. So if you have seed carrying the pathogens, they'll contaminate the entire system and animal become diseased. So the recommended stocking density as per the carrying capacity, that will decide how much the system can tolerate such carrying capacity. As per the carrying capacity, you can stock. Normally, we recommend in the spawn 20 lakhs per acre. For fingerlings, 4,000 numbers per acre. And for stunted yearlings, or called 0 point, we normally come around 2,000 per acre. And this will discuss about the biological agents responsible for inducing disease in animals. What are the biological agents? They are bacteria, virus, fungi, and parasites. They are the infectious agents. We'll discuss one by one. But very important to know that this disease pattern is different in different culture system. In pond culture system, it is different. In open water system, it is different. In pen culture or cage culture, it is different. In bioflux system, it is different. So what are the difference? So normally we find in a culture system, the water quality parameter, they're very, very important. Water quality parameter and the occurrence of parasite diseases. Parasite diseases are very important among all the biological agents. Among the biological agents, parasites nearly 35 to 37% occurrence. Number of cases will find that nearly 35 to 37% are parasitic, followed by bacteria. But here also water quality is very important. Proper alternation in water quality also very important. Then in open waters, in reservoirs or wetlands, in that we find the mostly the water quality deterioration or the other factors are more important than bacterial, fungal or biological agents. But in cage culture, the fungal agents are much more important than bacterial and parasitic. Here also water quality has some importance, but because of this high concentration of animals in a system, the fungal disease occurrence is much more. In biofloc, as you know, now it is everybody is running after biofloc system. The biofloc system, the most stressed culture system, because too much in a small area will having too much concentration or stocking density. So the water quality management is very, very important as you do in RAS system. Similar importance to be given to biofloc system in maintaining the water quality. So water quality is more important, followed by fungal and all bacteria. But the important thing is that nowadays we are getting many diseases having unknown etiology in biofloc system. Some may be viral, some may be other environment-induced stress, maybe multiple pathogens are involved. So the biofloc is a very typical system. More studies need to be given on this aspect. Now we'll discuss about the bacterial diseases which are occurring in aquaculture system. The first one is red disease, Lal Rog. Lal Rog is very common disease. In common disease in most culture systems where water quality is some normally poor, and sometimes during winter. So winter disease. The multiple pathogens are involved in this particular red disease. The red spots are usually there initially. The red spots become patches becomes lead to ulcers due to secondary infection. Now another disease called Aeromoniasis. Like Aeromoniasis, also Aeromonas species are also involved in the red disease, but they are causing only Aeromonas species. They are causing a disease called Aeromoniasis. The genus Aeromonas hydrophila, Aeromonas sobria, Aeromonas cabai, Aeromonas vironi, they are also involved in particular disease called Aeromoniasis. In this case, we'll find red patches in ulcers, say with secondary infection, we'll find, and animals usually die. Then another disease called tail rot or fin rot. Tail rot, fin rot. Tail rot, fin rot is so here is a bacterial-induced disease in multiple pathogens. Multiple bacterial pathogens are involved. In here, poor quality is very important predisposing factor in inducing this disease. Then another important disease is called Columnaris disease. The Columnaris disease is caused by Flowbacterium columnari. Earlier we are getting Cytophaga and also Flexibacter columnaris. These are the bacteria which affect all warm and cold-blooded, cold underwater fishes, and all size groups are affected with this disease. And this mainly due to high organic load, poor water quality in the system. We will find the bacteria multiplying on the wound and the yellowish discoloration on the muscles and gills, and we find ulcers in the back. Sometimes it is called saddle disease, and some we find hemorrhages, body hemorrhages, muscle necrosis, and the growth on the gills. So yellowish growth on the gills. And another important disease called dropsy. Dropsy is called edema disease or edema fish disease. It is a bacterial infection caused by Aeromonas and Pseudomonas species are involved in this, and these kidney is affected. In kidney of the fish is affected. So swelling of the abdomen due to fluid accumulation, and internal organs are also damaged. And this occurs due to poor quality. When poor quality is there, the bacteria they multiply in number and they induce the disease called dropsy. Another disease called Bacterial Septicemia. It is a systematic disease. Is called Hemorrhagic Septicemia. Is caused by motile Aeromonas and Pseudomonas also involved in this. I will find the ruffled scales. Scales are there, and fluid is accumulating under the skin. And here it becomes sometimes severe, and most of they die. Another important is called bacterial gill disease. Bacterial gill disease caused by a number of bacterial pathogens. They affect the gills, and the disease will find the presence of large number of filamentous bacteria. They grow on the fish, accompanied by clubbing and fusion of the gills. So we find along with the number of bacteria, Flavibacterium brachyophyllum is very, very important, which is involved in this particular disease. Then another is the eye disease caused by streptococcal infection or cloudy eye disease. The streptococcal disease, these are not very common, but sometimes it happens, and when it happens, it causes a lot of mortality. And we'll find the erratic swimming, and single or two eyes are affected. We'll find Popeye is like Popeye exophthalmia. We'll find or hemorrhages are there, corneal opacity there, or hemorrhages on the cornea, on the eye, in around the eye, other places on the body are common signs of the disease. Then we'll have the secondary bacterial infection that happens, we call scale loss. Scale loss is usually the mineral deficiency, is a calcium deficiency. So the scales are removed from the very loose on the body surface. They become loose and they sloughed off. But in that case, the secondary bacteria which are there in the water environment, they attack the fish, and fish usually die. Now we'll discuss some of the fungal diseases. The fungal diseases, they are also mycosis, they are affecting the fish, and three important fungal pathogens which are normally occurring in culture systems are Brachiomyces, Saprolegoniasis, or cotton wool disease, or EUS, Epigenetic Ulcerative Syndrome. We'll discuss one by one. Now, Brachiomyces is called gill rot disease. The gill rot, it affects the gill and multiply in the gill, affect the gill, necrosis of gill tissue. The fungal growth will be there, so you'll find the lot of fungal growth on the gill tissue, and this usually happens due to mismanagement, poor management of the water culture systems. There is overcrowded condition, high levels of nutrients, organic load in the water, and phytoplankton bloom is there. So animals in that become stressed, and the fungus they multiply in large numbers. Then we have Saprolegoniasis. The Saprolegoniasis is called Saprolegnia parasitica, the family Saprolegoniaceae, and the fish fungus, they appear initially in the white or grayish patches. Subsequently, lot of nutrients or the organic matter they tag in this, they get trapped, and those becomes color changes as per the environment. So normally it is small infection, the focal necrosis will find, and it becomes large and also affect the other scales and the surface layer, surface skin. Then EUS, everybody knowing EUS is very important disease. Some few years back, it affected the whole the country. This is called Epigenetic Ulcerative Syndrome caused by Aeromoniasis invadans, the fungus. The fungus, the primary causative agent. However, it is subsequently have secondary bacterial infection. The localized red spots are appear on the body size, and normally the Aeromoniasis species and other bacterial species, they invade and cause ulcers, and the muscles are sloughed up, and some fish die, and mostly the economic loss occurs to the farmers because the fish has no market value. Consumer preference is very, very less. So there are a lot of economic loss for this. Now we'll discuss about the disease problems in cage culture. Like I discussed, the cage culture now picking up because of this is a good source for culture. However, we'll find a lot of bacterial and fungal diseases occurring in cage system, and let us see some of the bacterial lesions, eye disease, gill rot, fungal disease. They occur in the gill rot in the cage system. So we are maintaining the water quality, or they maintain the cages, maintaining the nets, particularly cleaning the nets, the clogged nets, the source of all pathogens, so it should be properly cleaned. Now coming to the bioflux system, we'll have little discussion on this bioflux system. Now it is picking up. All farmers are now doing because it is a small area and high output concept is there, but it is a highly stressed environment. You should know that you should have lot of give emphasis and care. As in RIS system, you should need it. The bioflux system needs 24/7 attention, and because the stress is induces number of unknown diseases. Some of the pathogens which are present in the environment and in the fish, they show in number of symptoms. So we'll find some small ulcers, some skin lesions, Some animals die due to one or other reason, with unidentified pathology, unidentified etiologies. We'll find some of the viral pustules, some lymphoma type growth, and subsequently it is having secondary infection with bacteria and also fungi. They grow on this wound, and multiple pathogens are normally involved in such biflux system animals. Usually the ananas or the important species that we grow in that they are affected with number of pathogens and the virals induced secondary infection with fungi and fungi and bacteria. Then coming to parasite disease, as I told, in the culture system, freshwater system, parasite disease is very, very important compared to bacterial diseases. The parasites, the number one parasite which is responsible, they come in the category of monogenian trematodes. Monogenian trematodes, two types are there: Gyrodactylus and Dactylogyrus. Gyrodactylus is the skin flu; it affects the skin, and Dactylogyrus it affects the gill flu, called gill flu. So this is the picture of Dactylogyrus. We'll see. You take the sample from the skin, sample from the gill, and swab, or take the smear and examine under microscope. We can see the parasites moving, attached to the gill filament, or maybe moving. That we can see like as shown in the picture. If you take and stain it and see under higher magnification, you can see the full parasite. Another important disease is the Lornia and Argulus. They are two important: Lornia, Argulus, and Ergacillus. They are also commonly occurring in the freshwater system. The Lornia parasite, you see they're attached in the skin and they go deep. Their mouth is deep attached in the skin. Then, but among all this, important is a fish parasite called Argulus. Argulus is causing major impact in among all parasitic pathogens, and they are causing a lot of economic loss. As you see here, the cycle of Argulus, we find the Argulus parasites and the eggs. Controlling the fish, the Argulus eggs is very, very important aquatic system because the eggs are attached together and are protected. They're protected, so the drugs and chemicals don't have any impact on the fish, on the eggs. So we have to wait till the eggs hatch, and when the parasites come out, we can have some chemicals to kill the hatched parasites. Then coming to Ergacillus, this is another parasite normally attached to the gills. We can see here the number of eggs are attached, the egg pouches of the Ergacillus. And as I told, the parasite infections, there can be one or multiple. So mixed parasite infections are also very common in aquaculture system. Then we have mixozoan parasites or myxobolus. Myxobolosis, you have myxobolus which you can see under microscope, and trichodina, you can see the trichodina under microscope. Take this smear from the gill and examine under microscope. Then you have another important called freshwater white spot disease. In the white spot disease in the freshwater fish, this is called eek parasite or Ichthyopteris. The Ichthyopteris multifilius is very important, small size parasites. You see the microscope, you can see the parasites, you see their spores are there. They're attached together and they burst out, then come into the water and they attack the other fishes. Now will come the disease diagnosis and the control. Now will come to the one part is disease diagnosis and control. The diagnosis, different methods are here used. One is on-site observation, historical data collection, water quality estimation, gross pathology, sample collection for water quality and microbiological analysis, virology and histopathology, and parasitology. These are all these things done step by step. First, we are going to the site, having an on-site observation, then you collect all the information, then if possible, take the water quality parameters at this spot, then if not there, take the water sample and analyze in the laboratory. You can at this site, you can gross pathology or gross morphology, you can study, then take the sample to the laboratory for a further examination like microbiological analysis or histopathology analysis or parasitology analysis, and virological culture. And the on-site observation, what I do at the on-site observation, and very important that we have to visit the site, the culture system very early in the morning, usually before sunrise. So actual the status of the fish in culture system is known that time only. So that time you see how the fishes are moving, how they are behaving, what is their feed response, what are the environment status, any change in behavior, including their congregation, they're together or moving here and there, they're flashing their body or rubbing their body, and all these things is very important to observe. We will find that if that is happening, some maybe stress is there, some parasites there, or some injuries are there, or some growth or ulcers are there on the body surface, that will find. And if fish are coming to the top and opening their mouth or the gulping, we'll know that there is some DO problem is there. Then we will take out the fish and examine they are having some gross morphological any deformity is there, in gross morphology abnormality is there. Then we will discuss about the treatment of bacterial disease. For any treatment, you have to follow standard guidelines. First, you have to examine the water. Estimation of water, as I discussed, very important water quality parameter. You examine the water quality. You see it is accurate or stressful. If it is not as per optimum parameter, you can recommend for optimizing the water quality parameter. Then it is very important that any farmer should first consult an expert. Don't take decision asking the neighbor or the other farmer. You have to consult the expert, maybe scientists or district fishery officers or AFOs and the fish disease specialists. Don't ask a shopkeeper or the consultant shopkeeper or the feed consultant. Don't ask them. You ask the correct person to have correct diagnosis and correct recommendations. So intimate about the culture condition or the water quality condition, then accordingly the person can have some interpretation of the status of the fish. And the various drugs and chemicals are available in the market, so that can be used some. However, it is very important to know that we do have specific regulations in using drugs and chemicals in aquaculture. But you have to follow US FDA and government guidelines using such chemicals in aquaculture system. Give recommended withdrawal period after any treatment, maybe for parasite disease or bacterial disease, you give recommended, or using antibiotics or antiseptics, you give suitable withdrawal period. Otherwise, those stress chemicals or the parasitic antiparasitic drugs, or the antibiotics, they're in the tissue and they go to consumer, causing havoc. Now, different for bacterial disease, different antiseptics are commonly available, like BKC, benzalkonium chloride, iodophos, acrylflavin, and we have got from Shifa a good product called Sifax. Sifax is iodine-based product, very popular in controlling bacterial diseases and also some fungal diseases. It is controlling, so it can be used. And we have dimethyl ammonium chloride, that's Socrona, also people use a good antiseptic. But very important that you always follow USFDA guidelines in using the antibiotics. Only few antibiotics are permitted for use in aquaculture. There are oxytetracycline or tetracycline, then clotrimazole, trimethoprim sulfadiazine, they are also permitted. And those things can be fluorouracil can also be used. Don't use those drugs and chemicals which are used in human medicine or animal medicine, because they have restricted use there. So don't use such drugs and chemicals in aquaculture system, because they induce they pollute the environment and may result in development of antibiotic resistant bacteria, and it will have great impact, public health impact. And it is very bad that if we use so many drugs and chemicals like antibiotics, it will have impact on human. Now, there are some of the permitted antiseptics which have been used, permitted by the USFDA permitted. You can use. You see, details are given here, and I will send all details to you with a link. Now, fungal disease. The fungal disease very difficult to control. So water quality management is very, very important. If a poor water quality, the fungal disease occurs. So treatment of fishes with some antiseptics is better to have less number of parasites, and some antifungals who like malachite green, methylene blue. This can be used in aquarium fish for aquarium fishes. Well, those are very restricted. They are carcinogenic or chemicals, so they are very restricted. They are not permitted for use in cultured fishes or food fishes. Sifax is very good, as I already told. Sifax is iodophore-based compound. It can be very, very useful in EUS and other fungal diseases and some bacterial diseases also. So we can use. And we have also given some of the doses for fluconazole or tetraconazole, that the anti-parasite, antifungal medicines. This can be with limited application in controlling the fungal disease in culture systems. Now, these are the Coastal Aquaculture Authority and MPDA have banned use of such drugs and chemicals in aquaculture. You should take note of it and don't use such drugs and chemicals in aquaculture system. Now, for parasitic diseases, various antiparasites, drugs and chemicals are available in the market, and those chemicals can be used. But very important to note that normal chemicals like oxide or lime or calcium oxide, copper sulfate, formalin, salt bath, these are the permitted chemicals by US FDA for controlling the parasitic diseases. But these other chemicals, what you see now, is these are used in animal medicine. In vet medicine, they are used. They are not recommended in aquaculture use. However, some people are using in the aquaculture system. If you are using, be careful with the guidance of the expert, and using the cypermethrin or deltamethrin or ivermectin, ivermectin benzoate or amitraz. These are some of the drugs which are being used in aquaculture, but with the guidance of an expert. Now, for treatment of leak is different than the common parasites. So for that, you have different methods of controlling leak using methylene blue or malachite green or formalin or copper sulfate that you can follow. And the protogen parasites like nematodes, for those controlling these parasites, you can use albendazole or fluconazole or fluconazole. They are being used, and mostly for in aquarium fishes. They are being recommended for use, and you should use those drugs and chemicals with the advice of an expert. Now, coming to preventive control measures for diseases. So most diseases arise from stressful environment caused due to poor water quality or water management. So improving water management can lead to good health or reduce the occurrence of disease, incidence of disease. So what are the preventive control measures you can take? Maintain optimum stocking density. Always avoid overcrowding and excess handling. Optimum stocking density is very important as per the carrying capacity of the system. Don't overcrowd, don't push too many fish, and excess feeding, excess handling. Also, don't have excess feeding. What is required, you give. And importantly, you may employ or use farms biosecurity. Means the pathogens should not come from outside, should not come through some other animals or birds. Then you quarantine all new stocks, treat them with antiseptics before releasing into the pond. And proper disposal is very important of the dead fish. You should dispose properly. You would put in the pit and the deep pit, and also throw them away from the farm site. And we have got the SIFA different books and bulletins and leaflets for the different diseases and how to manage the diseases. We have got different bulletins, and we will send the link for these bulletins for your use. Now, in conclusion is that freshwater aquaculture system, in the freshwater aquaculture that we use, is a profitable, low-risk business, and it is a sustainable. So you should follow scientific advice, scientific guidance to have freshwater aquaculture. So you only have 100% chance will have successful freshwater aquaculture and with good profit. The fish diseases mostly occur with what is correlated to water quality and environmental stress. So maintaining proper water quality, avoiding environmental stress is very, very important. And the periodical monitoring of farm hygiene is very, very important. You should use very antiseptics or sanitizers you use. Always consult a specialist before using any aquaculture drugs and chemicals in the system. Now, the take-home message is that maintaining optimum water quality with less stressful environment is the only approach or best approach to disease management in freshwater aquaculture, specifically for freshwater fish culture. So, our only lesson or advice to all farmers and entrepreneurs, you give more importance to water quality management to have proper water quality environment. So, if you have good water quality environment, good environment for culture, you have 90% success or 90% chance of success of good harvest. Thank you all.